Well, today we will discuss about colorectal cancer liver metastasis in the early morning, 8:30 in the morning we will be there. And in the perfect spirit of ECIO, it's going to be like very multidisciplinary because we're going to have oncologists, high-level oncologists talking about chemotherapy, but also biology of the tumor. We will have the surgeon that will discuss the role of resection. We will have radiation oncology talking about SBRT, and ultimately also interventional radiologists talking about ablation from one side, and my topic, which is radioembolization. We want to focus not just on personalized medicine, but on how really patients play a role in final decision making, and that's going to be a very interesting discussion, I think.
In today's session on clinical trials and interventional oncology, we'll be talking about surrogates of overall survival and overall surrogates in clinical interventional oncology. One of the challenges that we have these days is with the development of new types of treatments, it's becoming more and more challenging to design robust randomized clinical trials, and the feasibility is becoming more and more challenging. So what we are doing is looking for biomarkers and surrogates of overall survival and of other clinically relevant endpoints that allow us to move the field forward and allow us to advance science to benefit patients.
In today's session, we'll talk about the important factors that impact your communication with the patient. That has not been stressed very much in previous years in medical education, and you will be surprised how important this is, and it can also improve the results of your interventional procedures.
My lecture will be about interventional oncology in MSK lesions in children. We'll talk about imaging. So first of all, depicting those lesions. There are tumor mimickers, which we shouldn't treat and not biopsy. We go into how we biopsy in small children different lesions. And then important treatment options, what you can treat in musculoskeletal diseases in children.
In today's session at Best of ECIO, I'll be talking about the work that we've done on the EMERALD-1 trial. In this trial, which looks at patients with unresectable HCC, we look at the comparison of patients who received TACE plus durvalumab plus bevacizumab versus those who received TACE plus durvalumab or TACE alone. Prior studies have looked at this using RECIST 1.1 as a endpoint. And today's session will be looking at the results using mRECIST, which is more commonly used by interventional radiologists.
So today in the ECIO Meets Esther session, we'll discuss on how clinical trials are made and how we share same challenges and endpoints in between radiation oncology and interventional oncology. But besides that, we'll see some very practical examples on how to build trials together and see how we can improve patients' care.
So this year at ECIO, Boston Scientific, we are super excited to release the data of PROACTIVE, the largest data set that we have in Europe, actually probably in the world, for HCC patients with radioembolization, glass embolization. We are also releasing the data of Eureka, which is also the largest data set you can think of, real-world data for cryoablation in kidneys.
As in the recent years, we've seen the importance of streamlining guidelines and standardizing the procedure. So we from Medtronic, we see it's important also for us to support gathering of that data to hopefully then in the future have improved guidelines and standardized processes for our minimal invasive procedures. So today we're very excited to have the Satellite Symposium at 2 o'clock. All of you today, you're welcome to join and ask questions to have a really interactive sessions.